Welcome to the We Talk Health Podcast, the official podcast for West Tennessee Healthcare. Please be advised that this podcast is not intended to replace any medical advice. Always follow your medical professional's advice and direction. Nothing said in this podcast is intended to supersede or supplement the direction of your medical caretakers. If you have any questions, please reach out to us at wetalkhealthpodcast@gmail.com, and we will do our best to answer any questions you may have.
Thank you for joining us for another episode of We Talk Health podcast for West Tennessee Healthcare. Today we are joined by Beckie Johnson in Martin, Tennessee. Beckie is a certified nurse midwife, and today Beckie is going to talk to us about what that means, the role of a nurse midwife, and how that impacts the community, her role here at Volunteer Hospital. And so we're going to talk a little bit more about that. So Beckie, welcome to your first We Talk Health podcast, first of all. And can you just tell us a little bit about yourself and tell us the benefits of seeing a nurse midwife?
Thank you. My name is Beckie Johnson. Like you said, I'm a certified nurse midwife. I'm also a women's health nurse practitioner. I've been practicing here in this community for almost 12 years. Lived here for 20 years. As far as a nurse midwife, the difference, it's almost like seeing a nurse practitioner versus a doctor. I take care of women from puberty until all the way through the elderly. I usually don't start seeing women until they about puberty age, but I do women's health, I do primary care, I also do OBGYN and postpartum. When you see a nurse midwife or a nurse practitioner, you do get a lot more one-on-one time than you do with sometimes when you get to see a physician who's very busy in their practice. You get a lot more teaching. We do a lot more of education for preventive care. I do a lot of educating in the community as far as our teenagers and our young women in our OB. You just get a lot of that in the clinic. We see a little bit of everything.
I think that's great. And you are also a nurse practitioner, so
Yes.
you can take care of women's issues. And
Yep. From puberty to the end, I do it all.
So annual visits, things like that,
Yep.
you take care of those there in the clinic.
We do all kinds of gynecological problems and gynecological health. We do primary care. If it's something that needs a specialty referral, we can absolutely do that. But we do quite a bit of primary care. Most women come to me straight from their pediatrician, so they don't really have, as we call, a grown-up doctor. So we kind of become that middleman. And as they grow through time, we kind of get them into whatever healthcare practice they need to be into if they need to go.
That's excellent. So we have talked to other providers here in Martin, and we know that the hospital has a partnership with an OB group and that the hospital has an OBED. Can you tell us a little bit more about that and how your role kind of weaves into that framework a little bit?
Yeah, I practice a little bit differently than some certified nurse midwives. The general practice out there in the community is that nurse practitioners and nurse midwives are working with their OBGYNs in the clinic. I'm a little bit different than that in that I am in my own clinic established here with West Tennessee Healthcare, but I'm backed by what's called OBHG. That is a group of what's called laborists. The best way I know to explain that is 10 years ago, nobody knew what a hospitalist was. When people started going into the hospital, they were mortified they didn't see their own provider.
True.
And now as time has evolved and medicine has evolved, the hospitalist is a whole new specialty of medicine. Laborist is that new push into the medical field. These are certified OBGYNs who truly specialize in the acute care of the OB patient in the hospital. So I have a whole group of them. I have 4 primarily that come into our area, but there is an OB doctor in the house all the time. They're an OBGYN, so any kind of gynecological problems that need surgery, I can also refer into them. They're always here to back us up. They see all the emergencies that come in or any kind of little problem that comes in through the hospital. They take care of those. As far as my patients, I try my very, very best to take care of my own patients in the hospital. The way I explain it to my patients is I take care of all my patients in labor and delivery unless I am physically not in this county. The way I do that is they take most of my secondary call. If my patients come in sick, just have some little problem, they're going to take care of those things. I take care of my patients in labor. I deliver my own patients. If there's an emergency and we need a C-section, I always have an OBGYN in the house. Like I said, they're also there for GYN surgeries. If any of my patients were to present with a gynecological emergency, they can do those surgeries. The patients that I see in the clinic that need surgery, I have a whole army of physicians that I use. The doctors here are OBGYNs in-house that work through the hospitalist group. They do a lot of my gynecological surgeries. But then I also have Dr. Ball and Dr. Wilson that are in Jackson. They work for West Tennessee Healthcare there, and they are actually doing some of my surgeries because they can offer robotic hysterectomies, very minimally invasive surgeries. And so we've started working very, very close together, and I've been sending a lot of my patients, and they're very, very pleased with that. And then I can do their follow-up care so they're not having to travel so far.
That's excellent. I think it just shows the connection between West Tennessee Medical Group that, your patients can receive excellent care right here, but if they need that higher level of care or that specialized care, I guess I should say,
Absolutely.
then you have those colleagues where you can reach across and contact them and send your patients for
very minimal inconvenience.
Yes.
It is. It flows very, very well. And even in like reading of my, like say ultrasounds, we provide very high tech ultrasounds in our clinic. We have one of the top of the line 4D machines. We do lots. But Dr. Hokie, who is actually a maternal fetal medicine doctor there at West Tennessee Healthcare in Jackson, he reads my ultrasounds for me. We have the technology that I can actually, if I have a concern, I can actually send my ultrasound straight to Dr. Wilson in Jackson or Dr. Ball or to one of my laborists over here. I can send my ultrasound straight to them and they can read them right then. So I have lots of connections to get pretty much anything done I need done.
Yeah, that is fantastic. Technology has really improved the way that we can do healthcare, and that's exciting. So
It absolutely has.
So I think that this is just a great service that we have right here in Martin, Tennessee, that you don't have to travel outside of this area to receive great, high-quality women's health care. So
It is. In our OB department, it's thriving. I chose to stay here in Martin because I felt like I had a part in building and growing this maternity center here. We practice, I feel like, the very best medicine in that, those women who are very concerned about even going into a hospital. We have a lot of those patients who would rather be at home or be somewhere outside of a hospital. We give our patients as close to that home birth as we can, but with that security of being underneath this roof all the way to the most medically invasive delivery that there can be. We can do all ends of that spectrum. And women really respond to that because it's like they get their option of how to give birth the way they want to, how much intervention they want. And, we do give them that.
absolutely. I think that's so important for women. I also think it's a great point that you made about the high quality of health care right here at Volunteer Martin, and I know that the sign on the building has changed multiple times over years. Maybe the name has changed over the years, but the quality of care has remained the same. And I think that's something that this community can be proud of when we're seeing community hospitals all across the state and the Southeast, the country really, closing. This hospital is still very active and has excellent, high-quality services that they offer for this community. So we're lucky to have you, Beckie, and glad that you're part of this team. Thank you, Beckie, for joining us for this episode of We Talk Health podcast for West Tennessee Healthcare. If you are interested in seeing Beckie on an outpatient basis, her clinic is located at 143 Kennedy Drive in Martin, Tennessee, West Tennessee Medical Group Women's Health. The phone number for the clinic is 731-587-5321. Again, thank you, Beckie, for joining us for this episode of We Talk Health.